Hello everyone, my name is Taylor Cardenas, and in this week's discussion I'll be focusing on septic arthritis in cattle, a skeletal condition that causes inflammation and degeneration of the joints. This disease is especially important in calves and dairy cows because it affects movement, comfort, and productivity. Septic arthritis is an acute or sometimes chronic joint infection caused by bacteria entering through the bloodstream, wounds, or improper injections. Once bacteria enter the joint, they trigger inflammation leading to swelling, pain, and breakdown of joint tissue. If the procedure or wound care is not done in an aseptic manner, the infection can quickly spread, causing osteolytic or lytic damage, meaning bone and cartilage are broken down by enzymes and inflammation. The most common infection routes in cattle include umbilical infections in newborn calves, penetrating wounds, or contaminated injection sites. Poor hygiene during calving, castration, or dehorning can also allow bacteria to enter the bloodstream and lodge in a joint, making prevention and early recognition crucial. Each joint or arthrostructure connects two bones at their euphasis ends. These bones are covered with a smooth cartilage surrounded by synovial fluid, which allows smooth flexion and extension during movement. When infection occurs, this fluid becomes cloudy, filled with inflammatory cells, and the surrounding tissues swell. The cartilage erodes, and the joint becomes a painful and stiff, restricting motion and normal locomotion. Recognizing septic arthritis is vital for early intervention. Common clinical signs include swelling, increased heat, pain in joints, and limb abduction, impacting mobility and overall health. Now, over time, reduced use of the limb leads to atrophy of surrounding myotissue, meaning muscles weaken and decrease in size from disuse. Because inflammation is expected, proper diagnostics are essential. Arthriocentesis is used to collect synovial fluid for analysis, helping confirm bacterial infection and inflammation. Imaging methods like ultrasound and radiographs assess the extent of osteolytic joint damage, swelling, and fluid acclimation. In some cases, diagnostic-scopy is used to visually inspect the joint interior. Immediate intervention is critical for septic arthritis. Treatment includes systemic antibiotics to fight infection, intra-articular lavage to remove debris and bacteria, and supportive care to reduce inflammation and pain. In advanced cases, surgical drainage may be necessary to prevent permanent lameness or joint infusion. Prevention focuses on strong hygiene practices and aesthetic techniques. Clean and dry housing, disinfected equipment, and careful handling during injections are key to preventing bacterial entry. Proper umbilical cord care in calves also helps stop infection before it reaches the bloodstream. And recognizing early signs and intervening quickly are essential to maintaining herd health and preventing economic losses.